Hello everyone. COVID-19 news. Life after COVID-19, what is going to change? The news is ripe with information surrounding the COVID-19 pandemic. We saw the amount of confirmed cases is plummeting in countries like South Korea. During a surprise move, Apple and Google teamed up to assist track the virus. Some countries are even thinking of lifting their lockdowns altogether. Yes, that's the great news we're all looking forward to, when this may be finally behind us. Let's haven't any doubt about it, this may come to an end. Like we discussed during a recent article, we'll have a vaccine and new, approved treatments supported many patients' data. We'll have new public health protocols too for a way to stop another calamity of this scale. These are needless to say. However, what's also needless to say is that the life that we revisit are going to be significantly different from the one we had before the outbreak. From healthcare workers affected by PTSD through new habits to a requirement for a shift within the point of care, we analyze how life will change after COVID-19, and also how life can and will change post-COVID-19 during a medical point of view. What will surely change? We've seen it all during this global public health crisis: overwhelmed hospitals forcing patients to sleep on the floor, mounting fear of being in proximity to others, but also the importance of a strong healthcare system. As a consequence of our collective and individual experiences throughout the pandemic, things will change within the healthcare landscape. Below we discuss 3 of the foremost significant changes we'll experience. 1. An unprecedented toll on healthcare workers. During this global tragedy, it's not only the economy or the population that are being affected but also the healthcare professionals on the front lines. The latter are enduring extreme work conditions and sacrifices so as to assist the infected. Despite a shortage of private protective equipment (PPE), they show up to figure using DIY solutions like ski goggles and bin bags with a high risk of being infected. Many are working overtime and witness patient after patient succumb to the disease. The anxiety of knowing you would possibly be in danger when you're doing all of your job are often very challenging for healthcare workers, says Terry Rebman, a nurse researcher and director of the Institute for Biosecurity at St. Louis University. It's physically and mentally draining. This may cause an inevitable spike in burnouts among the healthcare staff. Even before the novel coronavirus outbreak, some estimated nearly half the world's 10 million physicians had symptoms of burnout. Now imagine after COVID-19. Moreover, war-like scenarios where unclaimed victims are laid to rest in mass graves in NY are taking a further toll on the medical personnel. Quite burnouts. We'll see frontliners with symptoms of post-traumatic stress disorder (PTSD). After this pandemic subsides, we'll need to brace ourselves for the aftermath on medical professionals on the front lines. 2. Diminishing trust within the globalized world. In the pre-pandemic globalized world, we enjoyed a particular level of trust we mostly took without any consideration. We could travel almost without limitations, meet people without restrictions and order products worldwide. This may simply change after billions of individuals had to remain indoors for weeks. We will not be ready to travel that freely or enjoy the availability chains of the planet so easily. We'll consider before going somewhere or to satisfy someone. The pandemic is already exacerbating signs of social anxiety and agoraphobia. Regaining trust takes time, and these trends will happen for months after lockdowns are lifted. 3. Specialize in the healthcare system. It's tragic how the pandemic highlighted the shortcomings of healthcare systems worldwide. The overburdened hospitals need an upgrade on every level, from their infrastructures to their processes. These are going to be needed to make sure a secure environment for the personnel and patients, also to deal with any emergency situations. Artificial intelligence and COVID. For example, one among the explanations speculated for Germany's comparatively low death rate is its good medical care situation. Digital health showed its aptitude to affect such a crisis. We will expect to ascertain many governments put more specialize in healthcare. They will adopt similar strategies employed by other countries that better manage the crisis. As people within the front lines of the fight witnessed, with inefficient healthcare systems, we'll not be ready to handle subsequent outbreak. What can change? While we'll unfortunately witness the toll on our healthcare workers and face reduced trust, other changes could happen, counting on countries, duration of lockdowns and even personal experiences. Here are 3 changes we could see emerge as a result. First, get your new travel document, the immunity passport. Such a passport will function during a similar thanks to how passports and visas work. If you're certified to be resistant to the virus, you'll get a pass to resume your daily routine, and if not, you'll need to stay indoors. The UK government is already considering it and other countries might imitate. Second, it might even become a requirement to visit a rustic. As a matter of fact, it's already happening. In mid-April, Emirates Airline conducted rapid COVID-19 blood tests on passengers traveling to Tunisia from Dubai. This will enable us to conduct on-site tests and supply immediate confirmation for Emirates passengers traveling to countries that need COVID-19 test certificates, reads a press release from the airline company. Third, this sounds tons sort of a divide between the haves and therefore the have-nots, and is that the subject of ongoing debates. Some might voluntarily leave to catch the virus within the hopes of gaining immunity thereto. There'll be the lingering fear of unemployment thanks to being forced to remain in isolation without such a passport. Moreover, testing for immunity will inevitably end in false positives, people incorrectly identified as immune, undermining the efficacy of such a passport altogether. Thanks for watching. Don't forget to subscribe.